What is Down syndrome?
Down syndrome is a genetic problem characterized by the presence of an extra copy of chromosome 21. This is known as trisomy 21. A person with Down syndrome has typical features. He also has a learning disability and an increased risk of certain medical problems such as congenital heart defect, vision problems, or growth problems. There is no cure for Down syndrome.
What is the relation between age and the risk of having a baby with Down syndrome?
Anyone can have a baby with Down syndrome, but a woman's risk increases as she becomes older. For example, the risk in a 20-year-old woman is 1 in 1,500, while the risk in a 40-year-old woman is 1 in 100.
Who is a candidate for Down syndrome screening?
All pregnant women should be offered a screening test for Down syndrome. However, these tests are not compulsory. It is your choice as to whether you have the test or not.
What are the available Down syndrome screening tests?
Number 1. The combined test. The combined test includes a combination of a nuchal translucency scan and a blood test which checks for two measurements: free serum beta human chorionic gonadotrophin and serum pregnancy-associated plasma protein A, PAP-A. This combined test is usually carried out between 11 and 14 weeks of pregnancy. Number 2, the quadruple test. If you present late after the first trimester, you should be offered a quadruple test. This involves a blood test for alpha-fetoprotein, AFP, beta human chorionic gonadotrophin, beta-HCG, unconjugated estriol, and inhibin A.
What is the test result?
Firstly, it may be a lower risk result. If the screening test shows that the chance of having a baby with Down syndrome is lower than 1 in 150, this is a lower risk result. A lower risk result does not mean there's no chance at all of the baby having Down syndrome. Secondly, it may be a higher risk result. If the screening test shows that the chance of the baby having Down syndrome is higher than 1 in 150, this is called a higher risk result. A higher risk result does not mean the baby definitely has Down syndrome.
What happens if I have a lower risk result?
You can be reassured by this result. However, this does not mean your baby definitely does not have Down syndrome, although the likelihood that this will happen is very small.
What happens if I have a higher risk result?
If you have a higher risk result, you can decide to: Number 1, not have any further testing. Number 2, have a second screening test called non-invasive prenatal testing, NIPT. This is a blood test, which can give you a more accurate screening result. Number 3, have a diagnostic test, such as amniocentesis or chorionic villus sampling, CVS. This will tell you for certain whether or not your baby has Down syndrome.